You tighten the final knot on the bandage. Careful. Steady. The small dog lets out a soft whimper, then stops. Its breathing slows. Even. Alive. You wait a second. Then its tail moves. A small wag. You exhale. Good boy. You're okay. The owner rushes forward, relieved. Thank you. Thank you so much. You nod, already pulling off your gloves. Sticky, warm, into the bin. She pays, clutches the dog, leaves. The bell rings once, then the door shuts. Silence. You stand there, just breathing. Your back aches, your legs feel heavy. 12 hours, fixing things that can't tell you what hurts. You flip the sign. Closed. It swings, then settles. Your phone lights up. Dad, are you coming tonight? You pause. Check the time. 7:48 p.m. Late. Again. You type, I'll be there. Send. No reply. You grab your keys. Cold metal in your hand. You head for the door. Bang! The sound hits hard. You freeze. Another hit. Bang! The glass shakes. You look up. A man stands outside, drenched, breathing hard, eyes wide. Wrong. Your gaze drops. His hands, he's not holding a leash. He's holding a man, limp, barely standing, a towel pressed to his side, blood soaking through, dripping, slow, then faster. It hits the ground, mixes with rain. You step back, shake your head, point down the street. A hospital, 4 blocks. Your voice feels distant. He doesn't move, just stares, unblinking. Then his hand shifts, metal flashes. A gun. He lifts it, not aiming, just enough. Taps the glass. Once, twice. Soft, controlled, final. Your throat tightens. Your hand moves, almost on its own. A brief hesitation, then click. You unlock the door. They stumble inside. The door slams behind them. Mud drips. Water spreads. Boot prints across your clean floor. Dark. Wet. Wrong. You hesitate. Just half a second. Then move. You grab the man's arm. Heavy. Dead weight. Careful. Your voice shakes. You both lift him. Struggle. Slip. Almost drop him. Then, onto the table. A dull thud. You pull the towel away. Blood. Too much. Too fast. A bullet wound. Deep. Ugly. Still bleeding. You press down instinctively. Your hands turn red instantly. You look up. I'm a vet, you say. Your voice feels smaller now. I don't do this. The man stands there, still, watching you. No panic, no rush.
Just expectation. Fix him. Flat, cold, final. You swallow. Your eyes flick to the wound, then to the gun, then back to the man on the table. Fix him. Or your grip tightens. You already understand. No one says it. No one needs to. Fix him. Or join him. You check the wound, hands pressing down. Blood seeps through your fingers. Too fast. Too much. You lift the edge slightly. Look closer. The entry is small, but inside, damage. Deep. Bad. You inhale sharply. You reach for your tray. Pause. Wrong tools. Wrong everything. Scissors for fur. Needles for skin. Nothing for this. Nothing for him. You open a drawer. Then another. Searching. Hoping. Finding nothing useful. You don't have the right drugs. Not for a human. Not for this. Your mind races. Calculating. Failing. You don't have time. You know that. You feel it. Every second, he's slipping. Your phone vibrates. Loud. Too loud. You glance at the screen. It's starting soon. Your daughter. A photo pops up with a message. her smiling, waiting. You freeze, just for a second. Two worlds, right in front of you. You look back at the table, blood. Then, at the cabinets. You step toward them, open, shelves filled with supplies, labels you know by heart, animals. Only animals. Sedatives, sutures, tools meant for something smaller, simpler, safer. That's all you have. That's all there is. Behind you, you feel it. The man, watching, waiting. You swallow. Your hands shake just slightly. You whisper, "Okay, okay." Not confident, not certain, just moving forward, because stopping isn't an option anymore. You grab a vial, horse tranquilizer, your strongest option. Way too strong. You stare at it for half a second. This could stop his heart, or save him. You don't know. You don't have time to know. Strong enough to drop a 500-kilogram animal. He's not even close to that. Your mind starts racing. Weight, dose, guess. Nothing exact, nothing safe. You pull the syringe, hands slightly shaking. You draw it in. Too much? Too little? You hesitate, then push the air out. A breath, a whisper. "Please." You inject, straight in. The man's body jerks, a sharp gasp, eyes widen, then fade. His muscles loosen. Too fast, too quiet. You freeze, watch his chest. 1 second, 2, still breathing. Barely. You exhale. You have maybe 20 minutes before it wears off. Or worse, you don't think anymore. You move, fast, messy, focused, clean. You press hard on the wound. Blood slows. Not enough. Clamp. You grab whatever fits. Not perfect, but it holds. Your hands move faster now. Muscle memory. Instinct. Not training. Survival. Stitch. The needle pushes through. Skin fights back. Thicker than animal hide. Different.
Wrong. You adjust. Force it. Again. Again. The thread is thick. Blue nylon for large dogs. Too rough. Too visible. But strong. You keep going. 1 stitch. 2. 3. It won't be pretty. You already know that. But if it holds, he lives. And right now, that's the only thing that matters. You tie the final knot. Pull it tight. Hold it for a second, just to make sure it stays. Then you let go. You step back, breathing hard. Your chest rises, falls. You look down. He's alive. Barely, but alive. The rise of his chest, slow, uneven, real. You did that. You lift your hands, covered in blood. Not animal, not this time. You swallow. The gunman hasn't moved, still standing there, watching, not impressed, not surprised, just confirming. Silence stretches, long, heavy. Then he reaches into his coat. You tense. For a second, you think it's the gun, but instead, an envelope, thick. He tosses it. It lands on the man's chest. A dull sound. Final. Keep quiet. No threat, no anger, just a fact. You nod before you even realize it. He turns, walks to the back, opens the door like he's been here before. Rain leaks in for a second, then gone. Door shuts, and just like that, they disappear. No names, no trace, only you in the body and the blood. You stand there, frozen. Your hands start shaking now, not during, now. Too late. You look at the envelope. It sits there, waiting. You don't want to touch it, but you do. Slowly, you pick it up, heavier than it should be. You open it. Cash, stacks, clean, dry, real. You count without meaning to. $5,000. Your grip tightens slightly. Your mind goes quiet. Too quiet. You should call the police. You know that, right now, before anything else. Your eyes drift to your phone, still on the counter. 1 call, that's all it takes. You don't move. Instead, your mind shifts, not to the man, not to the gun, but to something else. The rent, due soon. The bills, stacked, unopened. Your daughter's school.
The message earlier, "Are you coming tonight?" You look down at the money in your hand, then around the clinic. Old equipment, cracked tiles, fading lights. You inhale slowly, then exhale. Decision made. Quiet, invisible. You turn away from the phone, pick up a cloth, start cleaning. Blood smears at first, dark red dragging across white tiles, then fades. Water, more wiping, again, until it's gone, like it never happened. You walk to the back, open a drawer, pause, then push the envelope inside, close it. Your hand rests there for a second, not shaking anymore. You whisper, "Just this once." You almost believe it. 3 nights later, 2 a.m., the clinic is dark, only one light on.
You're still there. You've been staying late, more than usual. Your phone rings. Sharp, sudden. You look at the screen. Unknown number. You already feel it before you even answer. You pick up. Slowly. Say nothing. A voice on the other end. Low. Calm. "You're the vet, right?" Silence. Your grip tightens slightly. You don't ask how they found you. You don't ask who this is. You already know. A pause. Then, "We need help. Same as before." Same as before. The words hang there, heavy, familiar. You close your eyes. For a moment, you see it again. The blood, the table, the envelope. $5,000. Your daughter's message. All you have to do is say no. That thought comes, weak, late. You exhale slowly, and in that silence, you realize something. You're not deciding anymore. You already decided 3 nights ago. You open your eyes, and you give them your answer. More patience, more nights, more blood. It stops feeling rare, starts feeling routine. Knife wounds, cleaner, sharper, easier to close. Broken bones, you learn how to set them, faster each time. Burns, worse, messier, but still manageable. You adapt because you have to. Then you improve because you want to. Your hands stop shaking, your breathing stays steady. You stop hesitating. That's when it changes. Money stacks up, envelope after envelope, 5K, 10K, 20K. You don't count it right away anymore. You just put it away, like it's normal, like it belongs there. You upgrade your clinic. Better lights.
Brighter, cleaner, no shadows, sharper tools, real tools, not improvised anymore. You tell yourself it's for safety, for precision, for survival. On the surface, everything looks normal. The sign still says open. Pets still come in. Owners still smile. You still say, "Good boy, you're okay." But behind closed doors, it's a different place now, and you know it. You tell yourself, "They would die without me." You repeat it, quiet at first, then easier, more natural. They would die without me. Most aren't criminals. At least that's what you decide. Some are just people who can't afford hospitals, people with no other option. You hold on to that, tight, because it makes everything simpler, cleaner. You believe it because you need to, because without it, this becomes something else, something harder to live with. Your phone buzzes again one evening. A reminder, school performance. You glance at it, then at the table, another patient, waiting. You tell yourself, "Just this one, then I'll go." You don't. You miss it. Then another. You stop checking the reminders. It's easier that way. Your daughter stops asking, "Are you coming?" No more waiting, no more hoping. Now she just sends a message, short, simple.
Good night, Dad. No question, no expectation. That hurts more. But you don't stop. 3 months in, you feel good. Not proud. You don't smile about it. You don't talk about it. But you feel it. Needed. People call you, rely on you, trust you in a way no one ever did before. That's your mistake, because it feels right. One night, you finish late, later than usual. The clinic is quiet. Too quiet. You lock the door, walk toward your car, keys in hand. The street is empty. No traffic. No sound. Then, you see it. A black van, parked nearby, engine off, lights off, waiting. Something in your chest tightens. You slow down, just a little. Too late. The door slides open, fast. Shadows move. Hands grab you, rough, precise. No panic, no shouting, like they've done this before. You try to react, but it's already over. Something hits your head. Darkness. You wake up. Too bright. White light burns your eyes. You blink. Vision slowly clears. A room. Clean. Perfectly clean. Too clean. Glass walls around you. Cold. Controlled. Nothing like your clinic. Real equipment. Not improvised. Not borrowed. Professional. Expensive. Precise. Everything placed exactly where it should be. In the center, a table. A body on it. Still. Important. You sit up slowly, head spinning. Then you see his face, and you recognize him. Immediately. Everyone would. The man who owns everything, and somehow he's here, in front of you. A voice behind you. You have 30 minutes. Calm. Measured. Like this is routine. You shake your head. Instinct. Fear. I can't. Your voice cracks. Weak. Wrong place to be weak. A soft sound cuts the air. Click. You don't turn. You don't need to. You know what it is. You look down at the man on the table. Then your hand drifts to your pocket. You pull out your phone. The screen lights up. Wallpaper. Your daughter. Smiling. Bright. Untouched by any of this. For a moment, everything else fades. The room, the gun, the blood. Just her. Waiting. Believing you'll come home. You inhale slowly, then step forward. No more hesitation. Time disappears. You move, faster than ever, cleaner, sharper. No wasted motion. Cut, clamp, control. Everything is precise, exact. Like you've done this 100 times. Your hands are steady. Too steady. That should scare you. It doesn't. Midway, you pause. Just 1 second. Your eyes fix on the wound, on the man, on the choice. You could stop, right now. Let him go. Let everything end. No more calls, no more nights, no more blood. Freedom. Right there, waiting. Then, a voice. Soft. Familiar. In your head. Dad, you said you'd come. Your grip tightens. You close your eyes just for a fraction. Then you continue. Faster now. No looking back, no second thoughts. You finish, tie the final stitch, pull it tight, step back. He's breathing, alive. You did it. Again. You wait for something. Relief, fear, regret. Nothing comes. You feel nothing. You step back, your chest rises, slow, controlled. You look around. Take me home. Your voice is flat, empty. Silence. Too long.
Then a sound. Heavy. Final. Doors lock. Not one. All of them. You turn. Something's wrong. On the table, movement. The man's fingers twitch. Then his eyes open. Slow. Too aware. Too calm. A smile spreads across his face. Not weak, not grateful. Knowing. You were never random. Your body freezes,
The words don't make sense, not yet. Then, light. Screens flicker on around you. 1, 2, 10. Every wall, every angle, footage. Your clinic, night after night. You, working, bleeding, choosing. Your routine, your habits, your patterns, all recorded, all studied. Then another screen. Your house, your street, closer. Your daughter, walking to school, laughing, turning back, like she feels something. Watched, always watched. Your breath catches. The room feels smaller, colder. The voice returns, behind you, everywhere. You didn't start this that night. A pause, letting it sink in. Then, you started this the moment you became useful. Your hands slowly lift, still covered in blood, but steady, too steady. You stare at them, and suddenly, you remember. That first night, the door, the rain, the gun, the choice. You thought you were forced. You thought you had no way out. You thought you were helping. You thought you were choosing. Your jaw tightens. A quiet realization settles in. Cold, permanent. You were wrong. This wasn't the beginning, just the moment you noticed. You lower your hands, and for the first time, you understand. You didn't choose this life. This life chose you. Long before you noticed.